All right, everybody. The ICU, intensive care unit, post brain surgery for an acoustic neuroma that was about the size of a golf ball on my left side. This part of it is pretty dark. Literally, it was dark in there. And also, I guess, kind of like the low point of the physical stuff. They put you into intensive care when you need intensive care, where you're at great risk of having something horrible happen, and you just need you need someone there all the time. So there's an intensive care nurse who's there taking care of you always, and is right there if you need her. And the one who took care of me was amazing, and I immediately kind of fell in love with her. Could have something to do with my being the most vulnerable I think I've ever been in my life during those 2 days. I was in there for 2 days. Couldn't do anything, didn't get out of the bed, couldn't walk. So how was I feeling? What was up? So my left side back here, obviously the skull had been removed for the surgeons to take the tumor out, and it was put back in with this titanium piece of mesh like this big, that was then, I think, screwed into my skull around it. Incision about 5 inches long, big scar here, so lots of stitches, so just a lot of pain just from the trauma of it, having your skull sawed open, put back together is just, it's ridiculous. I had a headache every day waking up for about a year after surgery. When I think of that now, I'm like, okay, yeah. So, headache, obviously. But I think the worst things were I was suddenly deaf on this side, because taking the tumor out made the acoustic nerve on this side stop working. So I couldn't hear suddenly on one side, which that's also a traumatic event, because you're used to hearing in this fullness, stereo sound, 2 ears, and everything your brain does with that beautiful sound, and now suddenly just one. And that never came back. So this is my only ear. Look, I got one earpiece in. That's how I always wear it. I'm used to it. This ear does not work. And then the other major thing was that I couldn't move half my face at all. So now it's minorly still like that. I can't move my face perfectly, or even well, really, but it's good enough, let me tell you. Because there are people who don't get this back. It used to be much more common, but less now. And who have, a face that starts to droop on one side, which is much more extreme, and a negative outcome of surgery. So I did not have that. But it was weird, of course, and I keep using the word traumatic, to suddenly not be able to move half my face. This is overnight. I went into surgery being able to move my face totally fine. But this tumor also grows right at the facial nerve. It's like this big bundle of your balance and hearing and facial movement. I could feel fine. And the tumor stretched this nerve out because it was quite large. And then when it was taken away, that made the nerve stop working. But at least it was still there, it wasn't severed. So then slowly it did come back, but that's a later story of recovery. It took a long time. So yeah, harsh, really harsh. Waking up in this dark place, catheter in so I could pee whenever. I don't think I went number 2 for, a while, like a week. I mean, I wasn't eating anything, obviously. I was on an IV of caffeine, steroids, and some painkiller. Steroids to keep the swelling down in the head, in the brain. Painkiller, obvious reasons. Caffeine is the only thing that kept me going. I lost a lot of weight in the hospital. Another nerve thing that happened was that I couldn't really swallow. So half my vocal cords didn't work for the same reason. Like a nerve that makes them move was not working properly. And I think even now still they're not working totally fine, but they work well enough. But right after surgery, like I couldn't swallow. So they had to... I remember that being like the prerequisite for me being able to leave the hospital was I needed to be able to swallow on my own. So I was able to do that after like a week. So learning how to like eat again, being able to eat again, and all that was a big part of the hospital recovery. The man, even just listing this stuff, I'm like, geez, that is a lot for a 21-year-old guy. I remember in the ICU, yeah, so it was dark. Most of the time I was asleep or unconscious, at least. Yeah, a lot of pain in the head, a lot of weird feeling, like a space inside my head, also weird. The headache that I had come in with, that type of headache, I basically never had again. That was the one that was behind my other eye. That was a pressure headache. And that was the one that was gone. Never experienced that again. I got a lot of other headaches, but that one I didn't have anymore. Yeah, so dark. I remember throwing up bile at a certain point. I don't know if you've ever thrown up bile. Weird dark green liquid. I was like, what is this? When it came up, because obviously I had nothing in there. So I was like, how can you even throw anything up? But this weird stuff came out. So that was another thing. And then the real, like, I mean, I like to talk about like emotional, psychological stress type stuff. So here I was definitely disconnected from everything still. I was just like, what happened? Like nothing was processing. My body was just totally in survival mode. Like something horrible had happened. Someone was taking care of me. Thank God. But there was a woman, so I wasn't alone in the ICU. There was a woman in the bed next to me who had had surgery, who the doctors kept coming in and the nurses, they were trying to wake her up. And they were yelling her name and clapping their hands. So they were like, Mary! Mary! This was right next to me. And I was like, what is going on? What is this? What's happening? Noise was painful. And I don't think Mary I don't think she ever did wake up. I think she died. Intense. So the neurosurgery intensive care unit, you can imagine, is an intense place. And I can't, like, the people who work there, the nurses there, I mean, amazing how they deal with it. I don't know. But what they see, I mean. So yeah, I was in intensive care for 2 days after surgery, and I feel like I definitely needed it. I probably didn't feel ready to come out when I did, but they did. They did move me to my own room after, I believe, 2 days. So that's a little intensive care unit story. What I can remember of it. Crazy to think about. What a life change. What a truck that ran me over. So yeah. Next up, I guess, recovery wing, which had a different vibe for sure. Where I started to wake up a little bit more. In any case, hope this is helpful to anyone who's, going into surgery or just did or just, is thinking about what it might be like. I know it's a pretty intense story, but, as you can see, I did make it through. I'm here, I'm sitting here, still going strong, 20-some years later. But yeah, that's all I got for now. Thank you.